Hi, my name is Vicki Weissman, and I am a UMA instructor. I am here today to talk to you about the therapeutic responses across the lifespan. You might wonder, what do those words mean? The therapeutic responses across the lifespan. Sounds like a lot. But when you think about it, you are working at UMA to become healthcare employees. As a healthcare employee, you need to have strong communication skills to provide therapy so you can help your patients and their caregivers in their times of need. So, therapeutic responses is how you respond to your patients. Across the lifespan means all ages. As a healthcare employee, you will be working with people of all ages, whether they're your patients or they're their caregivers or friend, or maybe you'll be working with other employees as well and supervisors. You need to be aware of how to communicate with all of these people. In order to provide good quality healthcare, being a good communicator is essential. So, with that being said, we just want to break down, what do the therapeutic responses across the lifespan mean to you, and how can I help you learn to do that in a better way? Well, first I'm going to start off by telling you a little story. There was a man named Gene Levant. Gene was the CEO of a big healthcare center, family practice, that treated people of all different age ranges. He was getting ready to have a staff meeting, and as he was preparing, he was realizing, wow, let me think about all these different ages that come into our clinic. First of all, we have infants. They are protected by their family, by their parents, and they can't take care of themselves, and they can't speak. Then you have children who are doing a better job, maybe getting some words out, and have a little bit more ability to protect themselves, but they're still limited in what they can do. Those children evolve into adolescence. Adolescents can be sort of private in nature and maybe not the easiest to talk to. You then might run into an adult patient who you think would be easy to talk to and that you could get along with well, but they might have responsibilities, worries that are bothering them, or have different cultural background components to their personality that make the communication a little bit more difficult. And then finally, you reach older adults. These older adults might be a little harder because they might have visual or hearing problems or other physical ailments that help them from communicating or getting along as well. Also, their intellectual abilities, cognitive abilities, might be a little bit diminished depending on their medical issues, their age. So, these are all components to think about when you're dealing with across the lifespan of how you communicate. So, Gene thought about all these things and he said, well, there are a lot of differences, but there are a lot of similarities too. When you think about it, there really are. So, we are going to be thinking about that a little bit more as our session goes on. So let's get into what else we need to know as to be good communicators. The healthcare professional should have a sound background and understanding of human growth and development. This is something you may have learned over the years in bits and pieces, but now that you're working to become a healthcare communicator, it's very important that you really think about how we grow and how we develop. First of all, you must think about the person's personality, their experiences in life, where they came from, where they are in their life cycle, as we said before, and their lifespan, their relationship to others, how they get along in the world, and what other things they might need in order to communicate with them well. One thing to always keep in mind is that as human beings, we are always growing and developing, no matter what our age is, and we learn from our experiences. So with that being said, I'm going to start a slideshow for you so we can talk a little bit more about how we grow and develop. So here we are, the therapeutic response across the lifespan. As we were talking about, as a professional, you need to look at the biological principles that make up human beings, the client considerations, thinking about the client as a person, what do they need, what do they want from me as a healthcare employee, growth and development theories that we're going to talk about in a minute, and then helping the client. What are the best ways that you can help the client? What communication strategies can you use? So here we go into the theories of human growth and development. Our personality and our cognitive skills build upon each other as physical growth and maturity progress throughout our life cycle. So when you think about it, you're not the same person you were 5, 10, 15 years ago. Your personality has changed and your mental abilities have changed. You have learned from your experiences, you have grown, and now you're ready to embark on this new career. To appropriately care for our clients, healthcare professionals must have knowledge of normal behavior for specific age groups and be able to interact on the client's level of understanding. So we need to know what is, quote, normal behavior. Now, normal to me is sort of a spectrum. There's some people who maybe are not quite the same, where none of us are the same as others, but some, usually it falls within a certain range of what we expect in life. And then you have people who are maybe outliers. So as healthcare employees, we need to be aware of all of that. Lastly, the healthcare professional might need to teach caregivers how to help their clients through a particular crisis or stage of life. So basically, somebody might be coming to a medical setting because they need help in a certain point in their life, or because, maybe it's, a sudden illness, or maybe it's just someone's diagnosed with dementia and it's like a change in how their care is going to be. So we have some theories. The first few that I'll talk about, and you can find these in Appendix A of your textbook, the theories of human growth and development. You have Ivan Pavlov. He had the classical conditioning theory, which is a simple form of learning, and he had an experiment with dogs you might have heard about in past schooling, where he rang a bell and gave a dog a bone, and then he did it again 2, 3 times, and then he just rang the bell, and the dog would start salivating even without the food being present, because the dog had conditioned himself to hear the bell and know he was going to eat. So the same learning you can find with a child going to a doctor's office. They go to the doctor's office, they see a needle, they get scared. So then if you keep doing that, the child is going to get scared even before she sets foot into the doctor's office. So these are ways people learn. B.F. Skinner also took that a step further and talked about operant conditioning, using positive and negative reinforcement. So maybe if you have that same scared child who doesn't want to get out of the car because she's at the doctor's office, if the mom smiles, reassures her, says she'll get a lollipop or a treat, maybe that'll bring her defenses down, and then she'll be able to go into the office and have her medical treatment. We also have Freud, of course, who talked about the id, the ego, and the superego, which are how we see our things in life, how we see ourselves within the rest of the world, and also it also talks about our moral compass and what we consider right and wrong. Other good theories of cognitive development are from Jean Piaget, who had motor activity involving concrete objects, and they result in the development of mental functioning. So basically, we play with blocks, and you do a lot of physical things, concrete things when you're a baby and a toddler, and how those lessons teach us how to take that information and then think about things in more of an abstract way as we go through our childhood and mature into adults. They also want us to know that family, culture, personality, and socialization of the sexes may also influence our differences in cognitive development. So obviously, people coming from different families might mature and see the world in different ways. I think we all can be familiar with that. There's also Abraham Maslow, who has his hierarchy of needs, which are motivating forces. Basically, we need food and water first. Then we can take that up to needing love and having self-esteem, and then seeing how we realize ourselves within the whole world. So it's kind of like levels, steps up, like what do we need? You need this in order to move on to the next level and to the next level in our development. One thing all these theorists have in common is that you can't move from one skill level until you mastered the first skill level. It's all a progression. We all might learn at different rates and through different ways, but we all have to progress the same way. There's Lawrence Kohlberg, who dealt with how we develop morally. And lastly, I am a speech language pathologist. And one thing we learned a lot in speech pathology school is about our physiological development and how it's a continuous process. And when you look at babies and how they progress to being toddlers and children and how they learn to speak, it's all stepping stones. It's amazing how much a little baby is soaking in and how much information they are getting from their caregivers. So it's important to keep that in mind if you do have small children at home, and really watch them. And if you can, look at the appendixes in your textbook, because you'll find a wealth of information that you might find really interesting about how we grow and develop. Okay. Right now, we are going to change the screen. And if you were with me, I would say, do you have any questions about this? But since I can't do that and I'm just talking to you, I would encourage you to go to your textbook and read some more or look at some of the other course information in the classroom to get more information about these theories, because they really are interesting. So first, we're going to talk about infants. We all love our nice cuddly infant. And as I said to you before, they are so smart and they grow and develop so quickly. Think about that little baby that comes home from a hospital and where they are at their year birthday. An infant is considered 0 to 1 year of lifespan. Now, you might think they're not able to communicate their needs, but really, infants can. They know when to cry and how to cry. They have different forms of crying. They know, and we know, that they need to be physically comforted and secure at all times in order to be happy and to grow and develop. Children who don't have that physical comfort and support, that's when delays start to occur and they don't grow with their language and their cognitive skills than the kids who have the nice, secure, and loving home and caregivers provided to them. It's also extremely important for the caregiver, the parent, grandparent, whoever it is in their life, to bond with that child. Feeding a baby, holding the baby in your arms with the bottle, that's perfect range where a baby can see your face and really connect and bond with you. And it's so important whether you're breastfeeding, bottle feeding, and that's why it's important for men to feed the babies with the bottles just as much it is for the women, so that anybody important in that baby's life is able to bond with them. And as I said, they're so smart. They're learning they're learning from your speech, how you talk, your facial expressions. They're taking everything in. Always know that when you're dealing with infants. Another thing that you might have heard about, which I definitely agree is a helpful thing when dealing with infants, is using sign language. You can say more and all done. You can say please and thank you. Those are 4 signs that really can help a baby communicate. It can help decrease their frustration, maybe not cry as much, and they imitate. If you sit there and every time they start crying because they want more Cheerios and more bottle, and you're like, more, all of a sudden the baby's going to start going like this. And instead of crying, they're making this nice little action, and you say, yay, that's awesome. So anyways, those are things to keep in mind when you're dealing with infants. So as I was talking about the therapeutic response to an infant as the healthcare professional, you want to educate parents about how important safety is and comfort, and giving those nurturing, positive, caring, loving vibes to the child. Those are so important to their growth and development. You want to be there to answer the parents' questions as best you can. And if you don't know the answer, find somebody else maybe within your clinic that can, or look online for resources. You want to observe how the parents and the infant interact. Maybe you might have some pointers. Sometimes we assume people know what to do, how to do it, and they don't really know. Especially some people have never really dealt with infants before. They might be scared or nervous or scared to ask. So you definitely want to observe and make helpful suggestions in a nice tone of voice, being a good communicator, as much as you can. You want to have a pleasant environment, and as always, you want to respect the cultural background of the family of the infant. So these are all really important responses to dealing with an infant. Also, I want to point out, looking at the picture here, talking to a baby at eye level, face-to-face contact is really important. They get a lot of cues from your face, the tone of voice you're talking in. They can tell if you're yelling, you're scared, you're happy, if you're loving. So you just have to really keep that in mind, and you'll be a great communicator when you're dealing with infants and their parents. So now, if you do have any questions, please, as I said before, refer to your UMA course and look at the discussions, the textbook, read it through, and of course, ask your UMA instructor. Lastly, I just want you to reflect on this topic and prepare to do the rest of the work this week. Use this content material in your readings, then your interactives, and in the course room. Do research on your own using the UMA library or other reliable sources to maximize your learning. Doing these things will help you get the most out of this topic for today. I want to thank you very much for joining me on this recording, and I wish you a great day. Thank you.